So today I'm joined by Dr. Turbalizzi, who is our state epidemiologist, and we're going to talk all things COVID-19 vaccine. So to get started, can we talk a little bit about the history of vaccines and how important they are in public health?
Sure, Megan, thanks for inviting for the interview. Before I start talking, I also want to mention that I'm a Missouri State epidemiologist as well. I'm a board-certified pediatrician, and I'm a practicing doctor. So when I'm talking about vaccines, vaccine safety, vaccine experiences, I speak from experience, not from books or journals. And besides, I have a background in science and scientific publications, and when I speak about scientific reports, I also have experience about those. Now regarding your question, development of vaccines and vaccinations were tremendous success of public health in the 20th century and now in the 21st century. Because of such a tremendous success, people do not remember hundreds of thousands of babies and older people dying from different diseases. People do not remember how babies were dying in the United States, tens of thousands of them, just from coughing themselves to death because the bacteria was choking them. People do not remember people dying from measles and those who survived having permanent brain damage. People don't realize that even today, like last year, according to WHO, up to 200,000 young babies died worldwide from measles. And a lot of this misery was eliminated because of the vaccines. And the younger generation do not recall this, and that's why they think that things were always the way they are today. But things were very different and much worse in the beginning of 20th century, even in the middle of 20th century. For example, give you one example, just like in Japan, 1970s, there was a concern that pertussis vaccine could be causing problems, and people started vaccinating. Within 2 years, cases of pertussis increased in Japan 40 times, 40 times within 2 years. And then people, when babies started dying, people went back to vaccinating again, and all this went away. So here is a very good illustration how quickly things may turn around when you drop vaccination and how quickly they can improve when you start vaccinating again.